The last segment addresses criteria 4, which is communication with patients and carers. And it's my great pleasure to introduce Clare Hennessy and also Lindley Bilby to cover off on this particular criteria. Clare's going to go first, followed by Lindley. I'm sure they're both well known to many of you in the audience. Clare is one of 2 transfusion nurse consultants at Eastern Health and works across 8 main sites, including Box Hill, Maroondah and Angeles hospitals. She has also worked across many nursing specialties in both the private and public sectors in Australia and the UK. The majority of her clinical experience has been in intensive care, and she continues to work in the area part-time. As a transfusion nurse consultant, Clare works closely with a multidisciplinary team that includes doctors, scientists and nurses to promote safe and appropriate blood transfusion. She is a member of both the Serious Transfusion Incident Reporting and Blood Matters Advisory Committees for the Department of Health and the Australian Red Cross Blood Service. Lindley will follow as they do a very smooth presentation, and Lindley has worked as a transfusion nurse within the hospital setting and at the Australian Red Cross Blood Service in Melbourne. She is currently the Program Manager of the Blood Matters program and a clinical transfusion practice improvement. Blood Matters is a clinical transfusion practice improvement program in Victoria. Lindley has a keen interest and involvement in the area of blood management and transfusion safety and has presented at state, national and international forums promoting transfusion improvements, the nurse specialist role and patient blood management practice. Please join me in welcoming them to address the last criteria.
Thank you. I'd like to say thanks to the MBA for giving us the opportunity to present some of the work we've done on consent at Blood Matters and at Eastern Health also. So as Lee said, I'm one of 2 transfusion nurses working at Eastern Health, and I had the opportunity to lead a working group on consent for blood and blood products at Blood Matters in 2012. There's our next slide. So this is just some of the background on consent. As you all know, the Australian Health Ministers endorsed the Statement of National Stewardship Expectations for the supply of blood and blood products at an Australian Health Ministers Conference held in November 2010. Stewardship in this context means responsible, sustainable and appropriate use of blood and blood products. This statement, together with the revised ANZSBT and RCNA guidelines for the administration of blood products, published in December 2011, and the new National Safety and Quality Health Service accreditation standards, address the need for informed consent for blood and blood products. This is the National Blood Authority's Blood Stewardship Principles, and they state that appropriate blood management requires that informed patient consent procedures are implemented for all patients. This is just an overview of the consent section of the ANZSBT guidelines, just stating that health services must have a transfusion consent policy for both adults and children that includes not only at the acquisition but the documentation of informed consent for blood products, the period of time the consent remains valid, refusal of blood products and when consent is unable to be obtained. Standard 7 has the developmental standard that outlines the need to inform patients and carers about the risks and benefits of blood and blood products and any available alternatives when obtaining informed consent. The process must be undertaken and documented in accordance with the informed consent policy of the health service. And I will talk about a little bit later that at Eastern Health, for example, we did have stated in our policy that the medical staff were supposed to document in the medical notes, medical record or progress notes, that they had had a conversation with the patient, and that was our documentation. However, that was poorly complied with, which I will talk about later. Because of consent's been a topical issue in transfusion I've been a transfusion nurse for 3.5 years now, and I think it started long before I did. And it's gained a lot of momentum with the publication of the revised ANZSBT guidelines and the national standards. So a working party was formed to develop some guiding documents to address some of these key issues. So, working group of 15 members first met in June 2012, and 2 documents were developed: a core elements of consent table and informed consent for transfusion template. Once these had been developed, they were approved by the Department of Health Legal Services prior to release, and they are now available on the Blood Matters website, and there's a link there for you. And this working group was also involved in the development of the Blood Matters Consent for Blood Transfusion Audit, which was conducted between August and December 2012. And Lindley will talk more about this later on. So this is the table now. As you can see, it's very busy, but you can also all have a look at it on the website. So it incorporates the ANZSBT RCNA guidelines, national standards, and some recommendations that came from the Blood Matters group. So it addresses obtaining informed consent, documentation of consent, documentation of refusal, and the inability to give consent. So it's actually a 4-page document. The first page I didn't include, that's just some definitions. This is the template that we developed to assist health services when developing their own form. It gives people an idea of what should be included, such as the duration of consent, what is being consented, whether it's fresh blood products or plasma-derived products, prompts for medical staff as to what to discuss, and a section, of course, for the doctor and patient or person responsible to sign. Now, we've utilised both the core elements table and this template at Eastern Health to develop and implement our own blood and blood products consent form. So, getting on to Eastern Health. Eastern Health is a very large service that spans 2,800 square kilometres in the east, and it's the largest geographical catchment of any metropolitan health service in Victoria, and there are approximately 750,000 people who live in the area. It operates across 29 locations, and our largest sites include Box Hill Hospital, Maroondah Hospital and the Angliss. We admit about 141,000 patients to hospital for acute care each year, and we treat the same number of people in our 3 emergency departments and perform approximately 29,500 operations annually. We also, in more relation to blood, we transfuse approximately 1,000 units of blood per month across our sites, most of which, of course, are transfused at our 3 main sites, Box Hill being the largest user, then Maroondah and then the Angliss. Now, getting on to the issue of consent. So, as I said, Eastern Health, we have had a requirement in our blood and blood product administration policy since 2005 for doctors to document this conversation they're supposed to have been having with their patients. Unfortunately, the compliance has been poor. This is an example of one of the earlier strategies that was put in place in late 2009, and it was a redesign of the A4 blood request form. And it had a prompt included in the requesting doctor section, which you can see there just in the dark blue section, that yes, no or unable to consent that patient. When this was implemented, they did see a improvement in compliance for a short period of time, but it was not significant enough, and nor was the improvement sustained. So this is also to give you some of the background at Eastern Health. This is a consent audit into the request form. So it shows, on average, it's about 15% compliance in 2011, and we did do a number of records, as you can see there, over 600. This is a snapshot audit in 2012, so that looks at both the A4 request form and the medical notes. So 20% of the A4 request forms in that year were completed, but only 5.7% could we find a documentation that the patient had been consented in the medical records. So very poor indeed. Saying that, I'll just say, the Department of Health audit that was conducted last year, when we did follow the actual blood products around to the bedside, we were a little bit buoyed by the results, in that we found that 80% of the patients we interviewed actually did have that conversation with their medical officer and were happy with the information provided. So that was good, but we knew that we had to do something pretty urgently to improve documentation of consent. So this is our consent for blood and blood products form at Eastern Health, which was adapted from the template the working group developed, but there are some alterations. We included a time period for consent. So our patients can be consented for an acute admission, and that stays valid for the entire admission, or for patients requiring ongoing transfusion, they can be consented for 12 months. There's also a section there to prompt medical staff to look at the risks and where to find information on risks so they can discuss that with their patients. And also, of course, the specific risks to the patient. This was a section that was requested by some of our senior medical officers because they had a specific risks section on the procedural consent form, and they wanted that included here. We have found in our initial look at patients that have had this filled out that that's not completed very well at all. So our consent rollout strategy and implementation. The form went out to all areas in the last week of August. The implementation phase, which we're in the middle of now, we expect to be 1 to 3 months. I think it's going to be closer to, it'll be 3 months by the time we do education to all the people that have requested it so far. We got endorsement and approval from the Eastern Health Blood Transfusion Executive Advisory Committee, which is a fancy way of saying blood committee. A memo from the executive or chief medical officer went to all staff advising the implementation. We advertised it a lot. We have a Blood Matters intranet webpage, so we've borrowed the name from Blood Matters, so people know where to find information, and that's utilised a lot by our staff. We also advertised on our Eastern Health intranet homepage, Eastern Health Weekly, which is a hospital-wide weekly newsletter, staff pay slips, so we can actually have a little sentence on everybody's pay slip advertising the fact that it had been released and it was available. Education sessions at each site, these are well underway, so they're both going to be hospital-wide and ward-based for medical and nursing staff. And we've also been invited to executive nurse unit manager meetings and medical meetings. We're going to have to update all our current resources, standards and practice guidelines, and we're going to audit, of course, once it's been put in place. So we've done a baseline audit saying that. I'll just show you. This is part of our advertising campaign. So that's Dr. Maria Borisak, myself, and my transfusion nurse colleague Janine Carnell advertising the new form with their big happy smiley faces, which I'm sure all the medical staff are very happy about too. So that's one of it, and this is also an educative poster that we developed just to really clearly spell out exactly what needs to be completed in each section. So that could be put up in wards, and it was also emailed to all staff as well. And so lessons learnt so far. So as I said, we're in the middle of our implementation phase. Having a champion in a position of authority was very valuable for us because we've been debating putting in a consent form for a number of years, but also with looming accreditation, we were fortunate to go through accreditation in the first week of September, which we passed, yay. But having a champion also, we had the Chief Medical Officer right behind us, and having him there and guiding the working parties for the consent form really made the process a lot easier. So we had that working group with representatives from high-use clinical areas, obstetrics, ICU, ED, haematology, oncology for the development and review post-implementation. Listening to the feedback. So we've already had one working group meet post the implementation to start the reviewing and refining of the form. Now, we don't think the content is going to change dramatically, but there'll just be a bit of tweaking here and there. And it's also been suggested that we put the risks of transfusion on the reverse of the form, which was something the transfusion nurses may have advocated. So that will probably be added to the back of the form, which would be a help to medical staff when they're having that conversation. Ensuring staff have access to resources, patient information brochures, risks of transfusion and links to relevant websites, and education and advertising is vital to the process. Just to finish, our baseline compliance rate was 25%, which isn't terrific, but it's much better than 5%. So we're hoping by the time we do our 6-week audit, it will have improved greatly from there. So, and hopefully by 12 weeks, we'll be over 70%. Well, he's hoping. So on that note, I'll hand over to Lindley.